Okay, next we're going to do chapter 11 on the elbow, and the elbow is combined with information about the forearm. This video is slightly different maybe from the PowerPoint you may have printed. I did update it to make it a little bit easier to understand. As we look at the joints, um, specifically the numerous joints at the elbow joint itself is the articulation between the humerus and both the radius and ulna. And so we typically call that the elbow joint. However, if we look at it a little bit more closely, you'll notice that there are actually two smaller joints. There's an articulation between the humerus and the ulna, and then there's an articulation between the humerus and the radius. So we call those the humeroulnar and humeroradial joints. Here's a picture of the humeroulnar joint. And you'll notice that there's a protrusion that sticks out on the left side of that picture. That is your olecranon. The olecranon is going to articulate with the trochlea on the humerus. The humeroradial joint is where the humerus and the radius articulate. You'll notice there's a space there, and that's significant. We're going to be talking about that later. The radial head, which is that rounded head on the right hand side at the bottom at the more proximal end of the radius there, articulates with the ulna also to form what's called the PRUJ. That we're going to talk about that in a moment. That's the proximal radial ulnar joint. On the forearm, as I mentioned, there is a radial ulnar joint. There are actually two of them. There's one proximal and one distal. This first slide shows the more distal out by the wrist. This is a picture that shows the proximal radial ulnar joint where the radial head articulates in the radial notch of the ulna. We know that these two different joints, if you will, can do two different things. They each move in different planes of motion. The elbow can move in flexion and extension. The forearm moves in pronation and supination. What is important to understand is that as we move the forearm, the radius is rotating around the ulna, and it rotates around at the distal end. At the more proximal end, it rolls within the notch of the ulna. Now, if you take your hand, put your elbow at 90 degrees, put your opposite hand underneath your elbow where you can feel that bony part at the bottom, and you pronate and supinate your forearm, you will notice that that bone that your hand is touching does not move. That is your ulna. The radius is actually rolling around the ulna. Now, as we look at the bones, part of the elbow joint, it's important to talk about the humerus. The humerus has a trochlea and a capitulum. Now, as we're looking at this picture, we're looking at it from the front, and you also will recall that the radius is the bone on the outside of the arm. So as we look at this, we are looking at the front of the left arm. There's the trochlea. It's on the inside, and the capitulum is on the humerus on the lateral side, on the outside. We're going to spend some time doing an exercise about this next concept in class. There is something that occurs called the carrying angle. When you put your arm completely straight, you will find that your hand actually is positioned laterally out away from the body, and that's for a particular reason, primarily because of the shape of the trochlea that articulates with the ulna and causes that angle to occur. What we do know is it's important so that you can bring your hand to your mouth, and also as you walk and swing your arms, your hand doesn't hit your hips all the time. What we also know is with women, we have a tendency to see a much larger carrying angle than we would with men, probably because of the size of the hips. So again, looking at the humerus from the back side, we have a medial epicondyle, we have a lateral epicondyle, and we have an olecranon fossa. Now the medial epicondyle is interesting because our ulnar nerve courses um, that medial epicondyle, and you might know that as your funny bone. Now the reason why you get that shock up your arm when you bump that against something hard is because you are hitting your ulnar nerve. And when you pay close attention to it, you will realize that that is the nerve that feeds the ulnar side of your hand, specifically your small finger and your ring finger, and that's where you feel the bulk of tingliness when that happens. The ulna then is part of the forearm, part of the more distal part of the arm. On the ulna itself is where that olecranon process is, as we demonstrated a minute ago, where you pronate and supinate, you can feel that piece not move at all. The olecranon process is here. There is something called the trochlear notch, and then another part of this more proximal end of the ulna is the coronoid process that's going to articulate with the humerus, the trochlea of the humerus. Out in front of the ulna, there is an ulnar tuberosity, and that every time when we see a tuberosity like that, we're going to be reminded that that is going to be an important attachment for some muscles. The brachialis attaches there. The radial notch is at the proximal end of the ulna that articulates with the radius. The styloid process is at the distal end of the ulna. If you feel the dorsal surface of your wrist on the ulnar side, you'll feel that process. That's the styloid process. Styloid process is another important attachment for the brachioradialis, which is an elbow flexor. Interesting, but it courses along the length of the forearm and inserts on the styloid process. The radius is the second bone in the forearm. We have a radial head, and then there is also a radial or bicipital tuberosity, which is going to be an attachment for bicep muscle. Keep in mind that muscles that are going to move the forearm and result in any kind of supination or pronation are going to attach on the radius, and you'll be reminded that the biceps not only produces elbow flexion but also supination because of the way it's positioned on the radius. The radial styloid then is at the base of the thumb. It's less prominent, but it's on the distal end of the radius. And we will spend some time talking about it in quite a bit more detail when we talk about the wrist and the hand, because it tends to break when we have a fall on an outstretched hand or a fouche injury. The scapula is another bone that we have to mention because it provides attachments for your triceps and biceps. Some muscles that are two joint muscles are going to actually originate up on the scapula and control motion of the elbow, the triceps and biceps. The brachialis is called the workhorse of the elbow. It's quite a big muscle, very bulky. The biceps brachii is here, where you can see the attachment from the scapula all the way down onto the radial tuberosity. It produces flexion primarily, but also supination. The brachioradialis is shown here. You can see that this is a forearm muscle. It attaches from the radius all the way up across the elbow and onto the humerus so that it produces flexion. It's a one joint muscle, just crosses the elbow joint. The triceps are primary movers, prime movers for elbow extension. There are 3 heads of the triceps. I don't require that you be responsible to know these, but there is a long lateral and medial or short head. And again, it attaches on the scapula, comes all the way down the length of the humerus, and attaches distal to the elbow joint. The supinator is a forearm muscle. It's got to attach, it's got to insert on the radius in order to create supination. So as you can see, it originates on the humerus and attaches on the radius to pull it out and roll it in an outward position of supination. The anconeus, we've mentioned before, is a helper muscle. It's protective. It helps with elbow extension and prevents pinching of ligaments during extension. Its own role. It does not have any prime mover role. The pronator teres is one of the pronator muscles. There are 2. One is more proximal. The other is more distal. Again, it's going to attach on the radius because the radius is what creates movement in the forearm. Couple of things to know about pathology related to the elbow joint. You probably have heard the words tennis elbow. Tennis elbow is also known as lateral epicondylitis. We will go over this in class, but the attachment for your wrist extensors is on the lateral epicondyle of the humerus. Therefore, with issues related to overuse of extension of the wrist, we end up with pain at the elbow. Medial epicondylitis is also known as golfer's elbow, and medial epicondylitis occurs from flexion of the wrist because again the attachment of the flexors of the wrist is up on the medial epicondyle of the elbow. We'll go over that in class. Lastly, it's important to mention nursemaid's elbow. Nursemaid's elbow is what happens when specifically a small child's arm is pulled a little bit too hard. What happens is there is an annular ligament that goes around the head of the humerus, where I showed you before there was that gap between, not the head of the humerus, head of the radius, where there's that gap between the radius and the humerus. There's a ligament that goes around that, and that ligament is very important for holding that radius in place while it rolls in that ulnar notch. If it's pulled too hard, the head of the radius can come out of the annular ligament. So here is a good picture of the annular ligament. You can see where there's an area where the ligament goes around the head of the radius and holds it in place. Pretty easy to dislocate. However, it can be popped right back in fairly easily.